exploring efforts to combat viral hepatitis with Lindsay Hebert and James Amugsi.
Could you both briefly introduce yourselves and describe your roles?
I am James Amugsi, a viral hepatitis advocate and physician assistant at Sandema Hospital. I prescribe antiviral medications to hepatitis C patients.
Can you give us an overview of the Coalition for Global Hepatitis Elimination and its main objectives? The Coalition for Global Hepatitis Elimination aims to eliminate viral hepatitis worldwide by strengthening local capacity and mobilizing commitment. It focuses on hepatitis B and C, promoting vaccination, testing, and access to treatment. The Coalition's strategic areas are connecting programs, building evidence, and mobilizing commitment.
Can you explain hepatitis and why it is a significant public health issue? Hepatitis refers to inflammation of the liver. It can be acute or chronic and has viral and non-viral types. The most common viral types are hepatitis A, B, C, D, and E. Non-viral hepatitis includes alcoholic, autoimmune, and drug-induced hepatitis. Viral hepatitis is caused by viruses, while non-viral hepatitis has other causes. Hepatitis A and E spread through contaminated food and water. B and C through blood contact. Testing is crucial as symptoms may not appear initially. The hepatitis B vaccine can prevent hepatitis B. The good news is that hepatitis C is curable. Common misconceptions about hepatitis in northern Ghana. Some believe hepatitis has a spiritual cause. Others think it spreads through eating together. Correcting these myths requires continuous education. What inspired you to become involved in hepatitis advocacy in northern Ghana? As a Mandela Washington Fellow, I have learned to give back to society. I have seen many people die of hepatitis, including close relatives. Hepatitis C is curable and hepatitis B is preventable, but many people don't know. Balancing my job, advocacy, and family has been challenging.
Could you discuss the key partners involved in the Coalition's efforts to eliminate hepatitis, particularly in Ghana? The Coalition works with more than 350 partners across more than 60 countries, representing all WHO regions. In Ghana, the Coalition has collaborated to improve our understanding of the burden of disease, strengthen national planning, and expand awareness. Currently, only 0.4% of persons living with HBV and only 4.69% of persons living with HCV have been diagnosed in Ghana. The Coalition provided a grant to local researchers and community-based organizations to implement the HEAT project. The HEAT project involved assessments of the epidemiological burden of HBV and HCV and a laboratory testing capacity assessment. Under Dr. Yvonne Narte, a team of field epidemiologists consulted public health laboratories and analyzed over 134,000 records. The HEAT project was implemented in coordination with the Ghana Health Service, and the Ghana Hepatitis Foundation organized a dissemination meeting to brief stakeholders. The Stop HEPC Ghana project was launched in March of 2023 to raise hepatitis awareness and inform Ghanaians on how to get tested and treated for hepatitis.
What specific projects or initiatives have you been involved in within northern Ghana to combat hepatitis? Could you share a success story or a notable experience from these efforts? Stop Hep C project, team lead at Sandema Hospital. No vaccination, no discharge policy for babies born to hepatitis B positive mothers. Babies receive hepatitis B monovalent birth dose vaccine before discharge. Awareness creation and screening tests for hepatitis C virus. Achieved 80 to 90% hepatitis C SVR rate at Sandema Hospital.
How does the Coalition monitor and assess progress in hepatitis elimination efforts in low to low-middle income countries? In 2021, the Coalition launched National Hepatitis Elimination Profiles. These profiles assess the status of hepatitis B and C elimination across countries. They bring together data on hepatitis burden, intervention coverage, and policy development. The profiles highlight achievements, challenges, and next steps. Assessing progress across WHO's target interventions is essential. The birth dose of the hepatitis B vaccine is crucial to prevent transmission. The Coalition tracks hepatitis B birth dose, policy development, and coverage. The full set of indicators is available at globalhep.org.
How do you engage and educate the local communities in northern Ghana about hepatitis prevention and treatment? I identify key stakeholders like the chief or assembly member. Permission secured, announcements are made through health volunteers or rooftop announcement. Venue, date and time are communicated. This method is very effective.
What are the main obstacles you encounter in the fight against hepatitis? Two of the greatest obstacles are political commitment and financing. The public health tools are available: vaccination for hepatitis B, reliable tests for hepatitis B, and C, effective treatment for hepatitis B, and cures for hepatitis C. However, these existing tools are not available to most persons living with hepatitis. All governments must commit to hepatitis elimination. The UN Group of Friends creates a forum for member states to exchange information on progress, innovations, and lessons learned. By raising awareness at the diplomatic level, the UN Group of Friends brings high-level attention to donor agencies and national governments. The moral and economic case for hepatitis elimination is clear. It saves lives and is cost-effective. The coalition recently published policy briefs summarizing the benefits of investing in hepatitis elimination. These briefs are available here, https://www.globalhep.org/projects-research/new-policy-briefs-consequences-inaction.
Can you share a story of a patient impacted by the coalition's efforts? Patient Ali from Bilsa North Municipal. Through the project, I received hepatitis C drugs for free. After treatment, I am now doing well. I am very grateful to the Stop Hep C project team.
This year's theme for World Hepatitis Day is Take Action, Test, Treat, Vaccinate. The coalition is committed to building partnerships for hepatitis B and C elimination. In Ghana, the coalition supports Stop Hep C to expand access to hepatitis B testing and treatment.
The Stop Hep C Ghana project aims to screen 50% of the eligible population and link 90% of identified patients to care.